Peer support workers use their own lived experience to support others on their recovery journey. The workers use practical assistance to connect with the service users, validate their story, and empower them to take control of their lives.
A lot of people that attend services find it quite difficult to open up about their mental health, especially when they're in a room with a stranger. I find that peer support, opening up, telling a bit of your story, really sets that ground for the person to be more comfortable. Over time, a relationship can build and people can share with you what they feel is most important to them in that moment in their challenges.
They see that we've been there, we've gone through the similar kind of challenges, and that we've done it and we can overcome it, and we're going to be there to support them and help them overcome every step that we can, and show them that they can rely on the other staff as well. So sometimes we're like the bridge between other disciplines as well, to get them to see that we're all there for the same reason, to help the person on their journey.
My life would have been very debilitated by my mental health in my 20s. I suffered with anxiety and depression. So I used my experience of using the services but also living with mental health to support people now that use our services.
You know, we're still on the journey. We sit with them, we cry with them, we laugh with them. You know, it's all human interactions, whereas a lot of them would probably have been desensitized to the normal human interactions.
So a lot of feedback and comments we get from service users is that, you know, it's informal, it's casual, but it's also professional.
So I suppose one of the models that I use in my approach at work is CHIME. So it's connectedness, hope, identity, meaning and empowerment. And I think they're aspects of everybody's life, but we lose part of that within our illness when people have become unwell.
Peer support is a mutual relationship. The word peer means on a level of equality. So I view that when I'm supporting the people. So for me, when I'm working with a person and I'm supporting them, I'm trying to normalise mental health as best as I can. I'm trying to bring it down to what I believe it is, and that's that it's a normal human condition that we all experience.
To see that it's not the way it is isn't the way it has to be. You can recover, that you can inspire hope, that you can have a life, that you can have a job, you can have a family, you can drive a car, that you can get back into education, and like there's no barriers.
Peer support workers like Ciara and Kelly play a crucial role in supporting the service users through their own lived experience. With their continued work, we can help aid the recovery journey of mental health service users right across the country.
Her support has meant a great deal to me. Having someone who understands from personal experience what it's like to have anxiety and depression. Her role played a huge part in my ongoing recovery.
It's different to the other staff, a more positive, there's a more casual approach.
At times you can't talk to doctors and nurses. Those days you feel you can talk to the person who's been through it. That helps to break down the barriers.